Thank you. Ladies and gentlemen, a pleasure to be here. Thank you for giving us the opportunity to present our latest data on Eyetronic optic nerve stimulation. We are a Germany-based startup company, and we focus prime target indication is glaucoma, leading cause for blindness in the world, affecting 80 million patients. This number is about to double by the year 2050. Current standard of care is very much focused on the eye, more specifically actually on the elevated IOP, either by means of medication or through surgery. And while this is absolutely necessary, it unfortunately also has shown to not be sufficient when you're treating normal tension glaucoma patients or when you would like to restore visual field or stop treatment, the progression of disease with this treatment. So we need to look beyond the eye, and more specifically, we need to look at the optic nerve, the link between the eye and the center of vision. And clearly in glaucoma, we do see that the optic nerve is diseased. We do see that there's a thinning out of the structure, the retinal ganglion cells and the axons. We see loss of structure, not surprising because of that. Then also there is impairment of visual field. So the objective has to be to address the optic nerve, glaucoma being a neuropathy of the optic nerve. Looking at the stages now of deterioration of the optic nerve, we can observe 4 different phases of the decline in function and structure. You see the red and the black lines respectively representing function and structure. After chronic stress and compensation mechanisms in phase 1, as a response to chronic stress, we do see that we have a survival mechanism setting in. And during that stage, we still have structure, but we are losing function. We have a decline in metabolism, which then leads to phase 3, where you have the cell death cascade, and then finally apoptosis, so elimination of cells. The objective now has to be to do something about phase 2, where we have a treatment opportunity, a therapeutic window, in order to do something about avoiding loss of structure. And one way of doing that is with electrical stimulation. Numerous publications of preclinical trials have been made in recent years, describing the mode of action, including neuropathic factors and increase of neurotraffic factors, and also positive immunomodulation, as well as increase in perfusion. All of these are leading to a triple effect. The first one being because of the nerve cells now having been reactivated with electrical current to protect themselves against further deterioration. Second one, as we see that we now have function increase, we also, with that, can see that we have functional neuro restoration, so vision can happen again. And finally, we've also seen the degenerated nerve fibers sprout and grow again, so we also, in the animal model, have observed structural neuro restoration. Now, we have taken these data and developed the Eyetronic system. It's a non-invasive optic nerve stimulation device. You see the stimulation goggles, which have embedded actually 4 electrodes, which are then being placed in the orbital space. And we have been able to observe the same effects that were observed in the preclinical trials, and that is a restoration of nervous activity along the optic nerve. That the signal travels along the optic nerve, we also have proof of, because we do have a biomarker. Patients, although they are blindfolded by the stimulation goggles, actually do see phosphenes, the perception of flashlights, which is a clear indicator with this biomarker that the signal actually gets to the center of vision. We have treated 500 patients in Germany, mainly commercially, and observed, if any, only benign temporary side effects. The therapy is applied currently in 10 consecutive sessions. Now, looking at the results, we have been able to observe, first of all, restoration of visual field. As you see on the left-hand side, see the perimetry taken pre, then 12 days post, and then 3 months after treatment. Moreover, a recent study published by the Charité Hospital in Berlin, actually 7 months ago in 2019, also shows that optic nerve stimulation does have an impact on the cortical area. We see an increase in alpha, which you see on the right-hand side in the topographic plot as well as in the box plot on the right-hand side. Moreover, when we looked at our 12-month data coming from 3 different centers in Germany, we have also been able to observe a halt in disease progression in 73% of the treated eyes, as you see on the pie chart on your left. We have also been able, 12-month post-treatment, to confirm partial restoration of visual field with optic nerve stimulation. If you look on the right-hand side and see the comparison responder group, non-responder group on the mean defect, you see that mean defect in 12 months is going down in the responder group, whereas increases, as one would expect in glaucoma patients over a 12-month period, in the non-responder group. We are continuing now to invest in clinical data while we continue also to commercialize in Europe. We have 2 investigator-initiated studies. One is a group in France, in Paris, 2 university departments working together with a group in Milan, and the other one also an IIT in Zurich, at the University Hospital in Zurich. We ourselves are going to start an FDA trial, 300 patients randomized to sham and to treatment in the 3rd quarter of 2020. We're in preparation of that trial. It's going to be a neuroprotection trial, 1-year endpoint, standard of care perimetry, and recruitment of patients going to be on both sides of the oceans in the US as well as in Europe. So if you're interested, come and see me after the presentation. We are fundraising to finance this study. Thank you for your attention.
Thank you, Carl.